All right, podcasters, welcome to another episode of the Thriving Dog Pawcast. I'm your host, Tim Berthold, and today on the show, we're lucky to have Dr. Tori Countner. Now, before we get into all things healthy about your dog with Dr. Tori, be sure to head over to thrivingdog.co and sign up for our email list so that you are in the know on all new episodes when we publish them, plus other special deals and offers that we have from many of our guests. And of course, we're also on Instagram at Thriving Dog. So on to Dr. Tori here. She is a veterinarian, holistic veterinarian, and founder of the Balanced Pet Vet in Southern California. She worked in general practice for several years before exploring alternative therapies at the Chi Institute of Traditional Chinese Veterinary Medicine. She believes in a balanced approach to pet care and incorporates both natural healing and Western medicine into her practice. You can learn all about Dr. Tori at balancepetvet.com or follow her on Instagram at balancepetvet. And I will share my screen here so that those watching on YouTube can see her website here. So thebalancepetvet.com, lots of stuff there, all about Dr. Tori, and you can sign up for her email list there. And then also at Instagram at balancepetvet. So Dr. Tori, welcome.
Thank you. Thank you for having me.
So why don't you take a second to fill in anything I may have missed there about your background and what you do, and we'll get right into things.
Yeah, so as you said, I'm a holistic or an integrative practitioner, and I believe that there's a place for both natural and Western medicine, but I want to make it easy and approachable for all of my clients and owners and pet lovers out there. So, trying to do daily preventative measures so that there's, no big illnesses or issues that come up with your pets later in life.
Got it. And today I'm really excited to get into, a pretty kind of broad general topic of how to care for your dog in crazy times. So, we are living right now in it's late March here in the time of coronavirus. So there's a few things that I definitely want to get into. One is a little bit about, coronavirus and all the implications of that potentially related to your dog. Second is, what to just do when your dog is off, they're not quite acting normal. My dog is acting weird. What does that mean? And then lastly, given so many pet parents are at home more hours these days with their dogs, and the dog, may or may not be used to that, what are some things to do at home to kind of, keep them, more acclimated to that change or to adjust in a healthy way? So that's going to be the theme of the show today, and you have lots of experience talking about all these things. So I guess first question I would ask might be top of mind for lots of folks, and they've probably already Googled this, but on the topic of coronavirus, I guess two questions is, one, can my dog get coronavirus? And if so, should I be worried? And two, can my dog transmit coronavirus?
Right. A lot of people are concerned about that, as they should be, just as we're getting to know what the coronavirus is all about. But at this time, there's still a lot of research to be done and kind of seeing how this all plays out. But at this time, there has been no dog that has come down with the illness of the COVID-19 with those respiratory symptoms. All of that at this time. There was one dog that tested positive in Hong Kong, was in quarantine, but never presented with any of the symptoms or the illnesses. So we don't think at this time, we're kind of in mid to late March, that dogs can contract it and spread it around. There is a canine specific and a feline specific coronavirus that has been around for years and years. It's usually GI. Some of it is respiratory as well. But that has, it really doesn't, affect the population as I see it. So they cannot, at this time, they cannot get the COVID-19 and they can't come down with symptoms, nor can they spread it then to humans. Even though that dog tested positive in Hong Kong and his owner was affected, it probably was transfer if, the human was, giving the dog hugs or just really petting the dog and around the dog. So again, it just really depends on where the swabs and everything were taken. In terms of if you are sick with the illness and you're petting the dog, and there's another person in the household, or there are other people that are in contact with the dog, it's very little possibility that the virus can be transferred from the dog's hair to another person. But just to be safe, I would say wipe down your dog. Again, if you are susceptible to that, or if you do have the coronavirus, wipe down your dog. You can bathe the dog. Also, washing leashes, washing collars, washing bedding, washing toys. Just practice good hygiene like we're doing for ourselves. I know all of us are staying at home right now, but once we start getting out to the public a little bit more, hopefully in the next couple of weeks, and people are petting your dog, strangers who don't know, where they've been. Again, just wiping down your dogs with some dog wipes, some canine wipes, even baby wipes if you have that. And again, washing leashes, washing collars, bedding, anything that comes in contact with the general public or people that are infected with the virus.
Got it. So just to summarize, it sounds like number one, there's no indication right now that dogs can have any sort of symptoms related to coronavirus. They might be able to contract it in the sense that they absorb the virus into their system, but it doesn't seem like it has any effect, at least at the moment. It seems like that. Mm-hmm. And number two, in terms of can my dog transmit the virus? It seems like, if anything, there's the potential, but probably low probability that through surface contact, through their fur, that the virus could lodge there, and someone, yourself, et cetera, could contract it that way in the same way that you might get it from a cardboard box, for example.
Yeah, and their fur is much more like fibrous, and it's not like your kitchen countertops where stuff can stay on there, so that the fur kind of absorbs it. So that's why I would say like leashes or like metal, the rings or anything that your dog has on the collars, leashes, that would be a little bit higher probability that the surface contact could transmit it.
Okay. So let's say that I'm a super paranoid person. I want to take all the right steps. And, this morning I was out in the neighborhood. I was walking my dog, and, she's an awesome, friendly golden retriever that's super sociable and likes people more than other dogs. And so, runs up to some people, and of course she gets some big hugs from them. And one of these people sneezes on her. If I wanted to take all precautions, I would probably, when I got home, have her in the backyard, give her an actual bath, make sure I wash the leash, everything else, scrub down really well. And before, bring her into the house where, who knows what else she might touch or lick or et cetera. If I wanted to be, extremely cautious.
Right, exactly. And so, that's not a bad thing. I think that's good hygiene. But yeah, it's just to keep everybody safe and just to make sure that they don't become a fomite or something that transmits the virus.
Got it. Okay. Well, I think we covered that one pretty well. So, take precautions. It seems unlikely, but dogs should probably practice social distancing as well. Okay. So next question, which is just kind of a, bigger topic is, of course it might be more common in today's times, given the virus and our whole routine has been upended, and we know dogs are very sensitive to that. But, you often hear people just say things like, my dog is off. My dog is acting weird. So let's say that, someone came up to you right now, Dr. Tori, and said, hey, my dog's acting off. She's acting weird. What should I do?
Yeah, so the first thing is, how are they acting off? First, you need to know normal before you can talk about abnormal. So what's their normal routine? Are they not eating that much? Are they not wanting to go on walks? Are they hiding? Are they having any GI upset, any vomiting, loose stool? Are they limping? Are they shaking? So first, kind of figure out and pinpoint what is off about them. So that's the main thing. And then, if they're having some GI issues, tummy trouble, there could definitely be some sort of stress colitis. So stress can really cause their systems to get a little bit of loose stool, an upset stomach, maybe they throw up a little bit, they're kind of off their food. So in that case, I would say, if there's some sort of tummy trouble, did they get into anything? Are they stressed out? Are you stressed out? Because they can definitely feel your vibes. And so you can feed them some bland food, rice, plain potatoes, plain chicken, just really bland food. I personally, I'm not a great cook. So, and one of my dogs has a super sensitive stomach. So when this kind of whole thing happened, I stocked up on rice cakes because I know that if he gets an upset stomach, I can just kind of put some rice cakes, decrease his food a little bit, and his tummy kind of normalizes a little bit.
Hmm.
So you can also do a little bit of bone broth that kind of helps settle the stomach. Um, and just watch them and make sure that if they are having soft stool, that it starts to resolve over the next 24, 48 hours. If they're acting a little bit lethargic or really not wanting to go on walks, is because they are truly just really not feeling well, or is there something going on? Does their back hurt? Are they limping? Is it an orthopedic issue? You can always take a video of your dog and send it into your vet. A lot of veterinarians are doing telemedicine or virtual consults, or they're doing kind of curbside medicine where you call and say, hey, I need to come in and see you. And they will send a personnel out to your car to get the dog and then talk to you once the dog is in the hospital. But getting a video of the abnormal behavior or whatever's off about them
Hmm.
is extremely helpful for veterinarians. Even if, we go back to normal and you get to see the veterinarian face to face, but are they shaking? Are they limping? Is it so subtle that, a veterinarian is trained to see those subtle limps, those subtle kind of shifts in body weight. So that can be extremely helpful. If they're not jumping up on the bed, the couch, again, just hesitant to walk, it could be a back issue or hind limb issue. So that is something to look for as well. If they're lethargic, it could be a number of things, but you can always check their gums. Are their gums pink? Are they, if you kind of press on their stomach, are they really tense and guarding their stomach? That could be an internal issue, or it could be a back issue. They tend to kind of guard their whole core if they're having a sore back. Are they drooling a lot? That could be something with their teeth, or it could be nausea. So just kind of really pinpointing what is the issue, what is off about them. And then going from there, you'll have a lot more information to talk to your veterinarian or discern for yourself. Okay, he's having a little bit of loose stool. He might have eaten something. He might be stressed out. Let's do a bland food diet for 24 hours. And if it improves, fantastic. If not, then we need to talk to a veterinarian.
Got it. So it sounds like the most common behaviors, based on what you said there, were, or at least the most noticeable ones, would be some sort of stomach issues, usually in the form of like diarrhea or other loose stools, or loss of appetite,
Vomiting. Mm-hmm.
vomiting, and then lethargy. So just not acting their usual self, not being as upbeat, etc. What are any others come to mind that are more frequent you see?
Those are the two main ones. When people say that they're off, it usually is like some sort of GI thing, or a lot of the times it's pain, and they're trying to mask the pain, and they get anxious also when they're not feeling well. And that also plays into anxiety of their routine is off. You guys are home all the time. The owners are probably pretty anxious right now and just on edge. And so they definitely feel that. They look to you for guidance. And so they can be a little bit anxious, a little bit more reactive. I know that my dogs are definitely feeling that way, and they're just barking a lot more at people that pass by and skateboarders and bike riders. So they're feeling my anxiety, and also like both my husband and I are home, and that's a lot different. So anxiety definitely plays a role, and there are some ways you can kind of decrease that, taking them for a walk, making sure that their routine is still in place. So feeding them at the same time, going for their morning walk, going for their evening walk, or whatever you do in between, keeping that the same. But also giving them attention. Sometimes we're just so stuck on like, I got to do my, work. I got to take these Zoom calls. I got to, figure this all out. And they're left just kind of staring at you, trying to figure out, can I get attention? So, just making sure that you're paying attention to them. But also there are some supplements like L-theanine, CBD, Zilkine, just to kind of calm their nerves during this time. And just making sure that, again, they're on their same routine, same types of food. You're not introducing anything new, because that will throw off their GI tract as well. If they're really, there's a whole host of other things that could be going on, but this is really to discern what exactly are they off about and what exactly are they experiencing, so that you have that a better kind of knowledge, or more things to look out for if you do talk to your vet. I know that allergy season is coming up. It's been raining here in San Diego, so we're not quite there yet, but a lot of dogs are going to get super itchy very, very quickly. So trying to prevent that, talking about bathing, bathing in oatmeal or an aloe-based shampoo, making sure that you look for fleas, because it's going to be flea season, ticks, even though we're not supposed to be hiking and kind of out in the parks and everything, but there are still ticks around here, especially after the rain. So making sure that you look for, are there fleas? Are there hot spots forming? Everything's blooming, so allergies, that type of thing. And making sure that you have preventative measures in place for when the allergy season is in full bloom.
Mm-hmm. Got it. In the earlier on there, you touched on something, which is that dogs can potentially pick up the stress of their owners. Can you say a little bit more about that, and maybe if there are any stories from your own experience, from your with your own dogs, or from your patients? Anything come to mind?
Yeah, I mean, I definitely, speaking with, friends and clients this past week while we're all staying at home, the dogs have much more nervous energy. So kind of just like running around, making sure like who's where in the house. When people come to the door, they're just barking a lot more. And so they're pack animals, and they look to us to say, are we safe? What's the pack doing? Are we going out for a walk? Are we just staying home? Are we stressed? What's going on? And so everybody's tension and how they speak and how they're interacting with other family members, that can send signals or cues to the dogs that something intense is going on, or we're all on edge. We all need to be aware of what's going on. So a lot of people have kids home from college now that are in the house. And so that creates a totally different dynamic. And there might be tension just because spending time with family is, not all flowers and rainbows. So dogs can definitely pick up on that. So it's more of like a territorial. So I have two dogs. One is just barking a lot more. The other one is kind of needing his own space a lot more, which is very interesting. So that's another tactic. They can just kind of hide away and separate themselves from the chaos and the energy and all of that. So on a daily basis, I give my dogs omega-3s, a probiotic, and a joint supplement. But the probiotic and the omega-3s, I think, will really help calm their nerves down, among other things. But I think it's super important to just really stay on top of their supplements, really stay on top of their health, so that they feel good and so that their energy can kind of acclimate to everybody else's energy. Mm-hmm. I mean, the main thing I can say is that, like, when I'm feeling anxious, I try and meditate or do like a breathing exercise, and then honestly, my dogs do calm down. When I do my yoga and meditation in the morning, they'll sit on the mat with me, and I feel their energy calm down, and everybody just has a better day. So I think,
excellent.
Calming yourself down will help your dogs as well. But again, there's the CBD, there's the L-theanine, ashwagandha. There's some really good supplements out there to add in to help with that.
Yeah. So in terms of, you started mentioning supplementation there, and what I heard was omegas, probiotics, and then of course there are some some supplements out there, even on the human side, that tend to have a very calming effect, like L-theanine, ashwagandha, et cetera. Can you just say a little bit more about those?
Yeah, L-theanine, I love it for my own dogs because it works pretty quickly in terms of I don't have to give it every day if I don't necessarily have to. Um, but it basically it helps calms the nerves down. It has calming effects. It's from it comes from green tea extract. And so that, it's natural, it's wonderful. I really like it. And it doesn't have the sedative effects as some other things do. Ashwagandha, that is an adaptogen. And so that kind of helps like the adrenal glands just like turn down the notch. And so it's really great just for overall systemic stress levels and also like in the moment or daily stress as well. CBD, I really like if you get, a good, legitimate, proper CBD, that can be extremely helpful for calming the nerves, as well as many other benefits as well. Sometimes that does have a little bit of a sedative effect in some animals. So that's something that you want to kind of try and talk to your veterinarian about long term. There's also a really good probiotic calming care from ProPlan, and it has a specific bacteria, Bifidobacterium longum, that they've shown over the course by like 4 to 6 weeks of giving it on a daily basis. It really has a calming effect, anti-anxiety effect. There's so much with gut and brain health, that link. So that's huge. And that's something that, really high anxiety dogs, that just, again, helps like turn down the notch on their anxiety. And also just like sitting with them. One of my dear friends does dog massage, and just massaging your dogs, petting your dogs, just kind of spending time with them will just help decrease that stress level. So that's also something you can do, and it really helps, bond you guys together as well. But that's wonderful as well.
Okay. Yeah, you mentioned ashwagandha, which I have in, for the golden retriever lovers out there and long-term listeners of the podcast. I have my Sonny's Forever Golden product, which is ultimate health and longevity. And ashwagandha is definitely one of the ingredients we have in there, and standardized to the 10% with analydes, which are the compounds that are known to have that kind of overall. I described it as like an internal massage for your dog.
That.
And very helpful and beneficial. I mean, golden retrievers are already pretty happy-go-lucky most of the time, but it was definitely an ingredient that we thought would be beneficial to include in there. So definitely encourage other dog owners to get that out there get that into their dog's regimen for that nice internal massage, so to speak.
Yeah. And, the fact that it just calms down the adrenal glands just they can hold so much stress, like cortisol, and that can lead to different systemic issues. So I think that's a great supplement, not just for calming, but just for overall systemic health, immunity and balancing out, especially with golden retrievers, for sure.
Got it. So the third topic we promised to get in here was, and we touched on it a little bit, was this social distancing and sheltering at home is going on. So now I'm at home. Potentially I'm home more with my dog, and they're thrown off a little bit. But we're all kind of getting into a rhythm of sorts, which I heard you say was important to keep up with those things that your dog is kind of used to. But what else can pet parents do while they find themselves at home with their dog awake for 14, 16 hours a day or more? And maybe, like you said, there are kids around as well. So let's throw them into the mix.
Yeah, so sticking to routine is going to be extremely helpful, not only for your pet, but for yourself as well. And a lot of dog parks are closed now too, which my dogs love to chase the ball. So that's kind of out of the picture. I do have a backyard, but it's not as big as a dog park, and they love, socializing with other dogs. So I've had to come up with other ways. You could, again, throw the ball in the backyard and just make a game out of that. It's been raining here, so we haven't been able to go outside as much. So helping to learn new tricks. My dogs can sit and they can lay down, and that's about it. They're not very well trained. So we've been working on, staying in their bed, staying out of the kitchen when we're preparing food. And it's actually been a lot more fun. And the dogs, you can see them learning and processing it. So teaching new tricks, teaching new boundaries, sit, stay, roll over, shake, stay on your bed, or, my dogs I taught a couple of years ago, when I put down their food, they can't eat it until I say the word okay. So I talk to them about, we're thankful for this day, and, it's wonderful. And they just wait there, like sitting. But that took some time to teach them how to do that. So now that I assume everybody is home for the most part, this is the time to really dig in and teach them new tricks. It definitely causes them to use their brain, which uses their energy more and also keeps their cognition up. So that's great. There's also food puzzles. So basically you hide, food or treats in different dog food puzzles. You can Google it, or go on Amazon, and they basically have to either touch some things or push some things or nudge some things with their nose to get the treat. So that can be really wonderful as well. Dogs also love to sniff. So sniffing new plants and where other dogs have been and new smells, that is extremely important to them. And it takes up, like a third of their brain is wired for that. So, going on walks for sure, taking your time with walks. A lot of people I see running with their dogs, which is wonderful. But sometimes just like, a 25-minute walk where they can smell everything, that can be really, really helpful for their mental energy and just their well-being. Again, if it's raining, or if it's like you're in an apartment, or there's a lot of people out on the street, and you can't really social distance. Sorry, my dog's barking in the background.
That's fine.
You can bring in like sticks or flowers or different smells, and just kind of like, put like a stick down and see if they smell, and just kind of make an obstacle course in the house of them sniffing, of them looking at different things. And again, like their sniff reactivity and just, new sights, new smells, everything will be really important for their mental energy, for their physical energy as well, and just help them burn that excitement, or that nervous energy that they have.
Got it. Now, while we're on the topic, how do you see dogs' diet being impacted by their owners being at home more often now in any sort of way?
So, I am all for a balanced diet. I feed my dogs a cooked balanced diet. Again, I don't cook for myself, but I get it from Just Food for Dogs and Nom Nom Now and Pure Dog Food. For treats, I give them apples, carrots, cucumbers. I give them what people call people food, but food is food. Food's for every species. So I'm hoping, and I'm really trying to get the word out to, if you feed your dog kibble, hopefully it's a well-balanced high-grade kibble, but you can also top dress it with, if you guys are cooking chicken, some lean meats, some bland veggies, just like a little bit of top dressing, just to introduce that into your dog's diet. I think whole nutritious foods is super beneficial. So I'm really trying to get my, my audience and my clients to do more of that while they're at home, and they can kind of monitor. And a lot of people are obviously cooking more at home. So hopefully we'll see more of that. If I have some clients that have some overweight dogs, I'm really getting them to measure, how much are you feeding? Like, how much? Don't tell me a scoop. Like, is it an actual cup, or is it half a cup? If they're feeding a half a cup, is it like a rounded half a cup? Because that's more than half a cup. So really getting your dog to slim down, which can increase their lifespan by at least 2 years. There was a study of golden retrievers that were obese and some that had great body score condition. And on average, they lived about 2 years longer than the overweight dogs. So I mean, there's a huge impact on quality of life and lifespan. So, getting pets to eat more whole, nutritious food and slimming them down or getting them to the ideal body score. Those are my two goals right now as we're all staying at home.
Yeah.
So yeah, and you can put in like pumpkin or cucumbers or carrots, like I said, to increase the volume and decrease the amount of kibble or other dog food that you're feeding them, just so that the volume is up.
Yeah. So on that topic, just like with humans, there's three elements to food, or so at least. There's what you eat, how much you eat, and when you eat. And of course, recently intermittent fasting has been a very popular phenomenon. And any thoughts in terms of intermittent fasting for dogs, and or thoughts on timing of feeding a dog twice a day, once a day, 3 times a day, etc. I know when I was growing up with Sonny ate once a day in the evening, and he was the typical 50% carbohydrate kibble, low grade stuff out there, and Sonny was probably a little bigger than he needed to be. But I wonder to what extent the fact that he was fasting basically for 18 to 24 hours maybe actually prolonged his life. Is there any literature, research, or just your general thoughts on that topic?
Yeah. I definitely believe in it, but under the right circumstances, and owners have to pay attention. So, I just want to make sure that people, first of all, are feeding a balanced diet. If they're going to do the intermittent fasting, we need to make sure that they're actually getting everything that they need. So that's step number one. But I do think there is some truth to that. My own dogs, they have always been fed twice a day, and I think that it's like embarrassing to say, but my French bulldog, I think he would go nuts if he didn't eat twice a day. And I could slowly train him, or I could just shorten that window. I usually feed them by 7:30 in the morning and around 5 o'clock at night. So if I could lengthen that window for a little bit more fasting overnight, that's probably the direction that I would go in. There hopefully will be more research. It's just hard to get research specifically in the veterinary community. So we're kind of taking a little bit of both of human science and what they've done in terms of research on dogs. But I definitely think that helps. Grazing all day for dogs isn't the best. And again, certain illnesses such as please talk to your veterinarian before doing these measures, but doing kind of like a liver cleanse, or in some cancers, that can definitely be extremely beneficial. But the people or the dogs that are, they get breakfast and then they get a little bit of snacks during the day, and they're kind of just like grazing throughout the day, you've got to be really careful about that. If you want to feed your dog 3 times a day, then just make sure, again, that it's within the guidelines of what they should be getting for their whole their calories for the entire day and nutrients for the entire day. And then maybe from dinner to breakfast, you just extend that window a little bit more. And a lot of it is due to convenience. When people were going into the office, it's when can you feed them in the morning and at night? So it is a little bit harder when the dogs are at home and it's not yourself where you can manage you're eating, and it's people are working, and so that's another big component of how caring for dogs is the human element to it. But I think if we can extend that dinner to breakfast time window, at least 12 hours, ideally like 16. But again, it's not always plausible when you take into account that humans are the ones that are feeding them. But I think there is a lot of great research in specific cases. I think it's extremely beneficial.
Okay. All right. Well, maybe one last question here. I wanted to dive a little deeper into something you mentioned there, and then we'll we'll wrap up. But around, I guess, two things. You feed your dogs a home cooked diet, and then you mentioned, there's always a challenge of making sure that that is balanced. So what could be an example of a balanced home cooked diet that a listener could take away with and maybe give a recipe a shot?
So we really need to be specific about the calcium, phosphorus, all the vitamins and everything that is added to the meals. So I highly suggest working with either your veterinarian, a veterinary nutritionist to formulate a plan. There's also balanceit.com, petdiets.com. Just Food for Dogs has a do-it-yourself kit that says, here's the recipe of, meats, veggies, carbs, and here's exactly what you need to give in terms of the nutrients to make it fully balanced. This is extremely important in puppies, different large breed dogs that are on the younger side when they're still growing. So I just want to say that you should definitely talk to your veterinary nutritionist, go on balanceit.com. Again, there's a lot of do-it-yourself kits that are well balanced for your dog. So I get my dog's food from Just Food for Dogs and Nom Nom Now. Both of those companies have veterinarians and veterinary nutritionists on staff, making sure that they're formulated properly. But in general, again, please talk to your veterinarian. But I say over the course of a week, as long as you're getting all those nutrients and everything that your dog needs within that week of feeding, then you can say, okay, I have a lot of vegetarian clients or vegan clients that want to feed their dog vegetarian meals. And I say there's not enough research yet. So why don't you just do 2 meals that are, a protein. So tofu, I like because we know that it's good and nutritious. And then, so a third protein, a third veggies, a third carbohydrates is a general rule if you're going to be cooking from home. But I do want you to talk to your veterinarian about what supplements to add in, like a good multivitamin, a good dog supplement to make sure that everything is balanced. I do the RX vitamins for pets, like those dog nutrients, if I am just doing kind of like a hodgepodge meal. Mm-hmm. Sometimes I'll do that, 2 or 3 times a week. So there isn't a straightforward answer because a lot of people will just take the recipe and run with it, and then 6 months down the line, their dog is deficient in some sort of vitamin or mineral. So that's why it's super important to do your research before. But in general, a third meat, a third veggies and fruits, and a third carbohydrates. And just make sure when you're starting off, if they haven't had that particular food before, just start with a little bit and increase, just to make sure that there's no tummy issues, that they can tolerate it well. They're just like humans, and we all have a different way of processing everything. So that's why I urge a lot of people to talk to a veterinarian about their specific cases.
Got it. So, and when you say a third protein, a third fruit, vegetable, a third, I guess carbohydrate or starch.
Yeah, starch.
So that would that be by weight? So a third of it. Let's say the total meal size for a smaller dog might be a cup. It'd be a third cup of each of those, like by weight kind of thing, or by volume or so.
Okay. Exactly. Yeah.
And that's just a thumb rule, like you said. Big disclaimer, right?
Yeah, if you want to start cooking for your dog, my advice would be continue on the specific dog food, whether it's a kibble, a raw, a cooked food, and then maybe 2 to 3 meals a week. You can do your own a third, and they should be balanced within that week of what they need, without having you go overboard on calculating the calcium, the phosphorus, the sodium, the potassium, all the vitamins, all the minerals, because that can get pretty tricky if you don't have a specific formula from a veterinary nutritionist.
Okay. Got it. All right, Dr. Tori, I think this has been great. So any final thoughts or advice for our listeners?
Just, I tell my clients, know your dog's normal, so that when things are a little bit off, you can say, oh yeah, he doesn't usually itch his ear for that long, or he never limps on that leg, or he always jumps up on that couch with no problem. So I think knowing your dog's normal, which many people do, which is great, can really help you in deciphering what exactly is wrong or a little bit off about your dog.
Got it. So pay attention,
Yes.
basically. Okay. All right, Dr. Tori, thanks so much. This has been great. So Dr. Tori Countner with Balanced Pet Vet. You can find her on balancedpetvet.com, where she has a email newsletter to sign up for, and of course on Instagram, also at Balanced Pet Vet. Thank you so much, Dr. Tori.
Thank you so much.